Right.
I want to hear how much in terms of dollars, how much fraud have you detected?
For our company so far, we believe that we are over 900 million.
900 million.
Wow.
Yeah.
And then how much has been like actually recovered?
So some of the ones that we have had are in the process of recovery. So the recovery process is also very interesting because you
Yeah,
only have a certain look back period.
correct.
Because again, remember, in healthcare, you're dealing with three different ecosystems. You have got the insurance, which is the payer, you have got the doctors and the providers, dentists, etc. And then you've got the patients. So you don't want to cause any abrasion. So if you
Mhm.
start going back with a look back period of 4 or 5 years, unless if it's like,
Totally.
kickbacks, etc., and you're sending them to jail, right? In most cases, your look back period is just 2 years. And a lot of these insurance companies, think about your local insurance company in a smaller state. They don't have enough people to go and do these investigations. So they
Totally.
end up just focusing on higher dollar claims. Let me look at the claim that goes into the hospital. But the home care claim that happens every day is $100 claim. They don't have, I can't pay my data scientist, $10,000 a month for them to just look at $5 claims or $10 claims, right? So that's where we and the edits, the algorithms, and also a little bit of the human intervention on the clinical side can optimize our solution and our focus for these clients and say, hey, give us your data set and we can become part of your engine in how you analyze data and give good reporting. So we have dashboards, they can report now to the
Yeah.
government and they can do all sorts of things. So this is an area right now that a lot of innovation. And I do think if you were to put a number, I honestly believe in the US healthcare system, you are looking at almost, probably $1.5 trillion. Remember, they spend almost about US
Fraud, waste,
spend,
and abuse.
Fraud,
yeah,
waste, and abuse.
almost close to almost $8 to $10 trillion a year in healthcare. So the US
So you
economy,
say 10% of that is probably at least wasted, if
fraud,
it's
waste,
not
and
fraud.
abuse.
Right.
I know of cases that I've done in POCs and working with clients where there is a durable medical equipment store that is in the middle of nowhere.
Why is it so
And
easy to get away with?
because there's a lot of data in the system. And there isn't, a lot of these processes were manual and by the time you catch the fraud, it's 10 years
Mm,
down the line when somebody does a
yeah.
very quick
The scale's
outlier.
big. The data sets are
Exactly.
disparate. It's manual. It's like, it's a number of different things, but like, yeah, it's very logical actually. Like, and people have figured this out and they've been gaming it for a long time.
For years, for years.
Yeah.
Like I always laugh, like, politically, it's always like, I want to eliminate fraud, waste, and abuse. And it almost is like a throwaway line so that people can get away to the next question. I think the focus here is important. I think there are real dollars, but I also don't think it's just like in healthcare, in finance. I think if you look at housing, FEMA, like the Fed, it's an insurance program, right? When people, there's a lot of places where if you bring good technology into how those services are being delivered, you can possibly avoid people that are going to be wasteful or downright commit fraud.